Hello, everyone. My name is Dr. Manjiri Nadkarni. I'm an Ayurvedic MD, registered holistic nutritionist, and I'm back today for another session on Wellness Wednesdays. So, for Wellness Wednesdays, every Wednesday at 7 p.m. Eastern Time, I will show up live to discuss a certain topic. And this topic is something that's very specific about the most common conditions that I see in my practice. So I want to explore that. I want to help you understand what it's going on and how you could be suffering from it. And that is why for this month, we are talking about histamine intolerance. Histamine intolerance is quite a common condition, though it is relatively, unexplored or misunderstood, or sometimes people may just think that, oh, I have allergies or that's what I'm dealing with, but in fact it is different than a standard allergy. Histamine intolerance is a condition where your body is unable to effectively metabolize and manage histamine, and what this creates is a lot of histamine builds up in your body, and that leads to allergy like symptoms. So there can be a variety of symptoms that somebody could deal with. An example is, you may have a lot of digestive issues. You may struggle with headaches or migraines. You may have a lot of flushing reactions, lots of hives on your skin. There could be diarrhea. There could be a lot of pain when we talked about digestive issues. There could be nasal congestion. You could be extremely fatigued. You may have anxiety. You may have dizziness. So, this histamine intolerance can create both physical as well as mental, emotional symptoms of, related to anxiety or depression. And that is why it is super important to understand whether you have histamine intolerance or not. So, people who do not have histamine intolerance can actually eat a variety of foods, also the foods that contain histamine, without having any problem. So, if you are eating lots of fermented food and you see that, oh, I'm reacting to it, or you're reacting to foods like spinach or strawberries, or any of the cured meats, or if you are reacting to bananas, avocados, there is a chance you could be struggling with histamine intolerance. Now, histamine intolerance, though it is common because I see it a lot in my practice, it is not very well understood. It is not often diagnosed in a proper way because you have to get it diagnosed via certain tests. But there are other things that can indicate that you may have histamine intolerance. So, standard food testing protocols, I have a lot of people who come to me and they're like, oh, I've been tested for foods and my food blood test did not show up any problem. That is because histamine content in the food may not show up on your tests. Again, different people have different thresholds of histamine intolerance, right? What will trigger one person is not going to be seen in the other person. That is where the standard food testing protocols may not work for all the people. And some foods may not contain lots of histamine, but they will make you trigger a lot of histamine in the body. An example is when we talk about aged cheeses or fermented foods or alcoholic beverages, they actually stimulate the histamine release, and they can also inhibit the enzyme DAO that is going to break this histamine down, right? So that is one of the things that why people don't understand they have histamine intolerance. One of the other reasons is that it's not that you immediately eat a certain food and you immediately get a reaction. So histamine intolerance often has a lot of delayed reactions. The reactions are not immediate on eating. They could happen in few minutes or few hours, and they can often be delayed until the next day. So you may not realize that, oh, I'm dealing with histamine intolerance, because you eat something today and you may see a reaction 24 or even 36 hours later. And that is how it can be a little bit complicated, and often people cannot correlate what's going on with histamine intolerance. Again, histamine intolerance is influenced by multiple factors, like somebody that has a really poor gut health. If you have a lot of bad bacteria in your gut as compared to the good bacteria. You have what we call is gut dysbiosis. So you have more of the pathogenic bacteria that are going to create certain toxins in your system, that is going to worsen your gut health, and that is going to trigger your body to make more histamine as well. Certain pathogenic bacteria can also push your body to make more histamine, and that is why it is extremely important to understand what's going on in your body. And even when choosing probiotics, not just pathogenic, but even certain good bacteria can trigger more histamine in the system. So you have to know that, okay, I have to take this probiotic which is not going to trigger my histamine. So probiotics, histamine, we are going to talk about it a few sessions later. Next session we will be talking more about all the foods and how they are going to impact histamine. Today, we are going to stick to the testings of histamine intolerance. So, what are some ways? So, this is one of the most commonly asked questions that I have come across, that, oh, I suspect I have histamine intolerance. How can I test it? So, if you want to confirm histamine intolerance through the blood, you may have to get it tested by your family doctor or through your specialist. So you will have to ask your a family doctor or a specialist for a histamine blood test, and that can show that you have elevated numbers of histamine on the blood test. So elevated histamine levels can indicate intolerance, but it may not give you a confirmed diagnosis, again because it is variable. Your histamine levels may change depending on your diet or your intake of histamine related foods. But this is one of a good way to understand whether you have a high histamine buildup. Now, what is the second way to test it is the most common way. This is more conclusive. That is the diamine oxidase or the DAO levels. So it is the enzyme that is actually breaking the histamine down in the body. And people struggle with histamine intolerance because they cannot break down the histamine in their body, and that will lead to overall body symptoms, allergy related symptoms, mental fog, brain fog, stomach issues, gut issues. So if you go for a test that actually measures the DAO levels in your blood, we can understand if there is deficiency in the DAO activity. We can also check for something called zonulin, which is more of a test for leaky gut or intestinal impermeability permeability, sorry. So intestinal permeability is when you have a lot of the food substances crossing the intestinal barrier or the blood barrier, getting in from the intestines into the blood, which should not happen on a regular basis. So if your intestines become permeable, in a very crude language, it's called leaky gut. It's one of the most common languages, common terminologies used today, and that can be tested by a factor called zonulin. And if you visit me in the clinic, or if you are worried about histamine intolerance, I could get both of the enzymes, DAO, tested for you as well as zonulin tested for you. So we can definitely do that in the clinic. The third way histamine is tested is under the supervision of a medical doctor, where you are given a histamine challenge test. So you are going to be eating a controlled amount of histamine containing foods while you're being monitored in front of a medical doctor, and that is called the histamine challenge test. I use the fourth one that I'm going to talk about now quite a bit in my practice, and that is keeping a food diary and symptom tracking. Now, food diary and symptom tracking is fantastic for histamine intolerance, but food diary and symptom tracking is also super important for anyone and everyone that is dealing with poor gut, poor gut health, a lot of gut related issues, whether it's diarrhea, whether it's constipation, whether even you have nausea or heartburn, even any non digestive symptoms like getting a migraine or joint pain or being tired, being fatigued. If you keep a food and symptom journal, you will be able to find out a lot about what's going on, and you get valuable insights into what kind of food is triggering you. So whether we talk about food allergies, food insensitivities, or whether we talk about histamine intolerance, keeping a food diary is super, super, super important. So start by recording everything you eat and drink and write down any symptoms that you have experienced. An example is, I ate a bagel for breakfast and within 30 minutes I developed a headache, or I had an avocado toast for lunch and suddenly I broke down into hives, right? So you have to record every single thing that you eat, including the ingredients of the food. So again, the bagel, if you are getting from a grocery store, you can even take a picture of the package and what are the contents of it. uh, if you have it with cream cheese or whatever foods you're having, try to record each and every food you're eating as well as the symptoms. And one thing I often tell people is grade your symptoms on a scale of 1 to 10, so you can also understand the severity of symptoms. So today, if you are eating a certain food and that's triggering you to a 10 on 10 where you completely break out into hives, and then you start working with a practitioner, and then you're doing a lot of protocols to heal the gut, then after a month or 2 months you should see that, oh, now it's only a 2 out of 10. So then you also know that those treatments are working for you. So this is super, super, super important to know. And this is super, super, super important to understand that keeping a simple food diary along with symptom tracking, along with tracking the intensity of the symptoms, will give you a lot of information, especially a lot of information about what could be your triggers of histamine intolerance, right? And you will be able to identify the patterns. And if you yourself cannot identify the patterns, then you can take the diary and go seek a practitioner. I have a lot of clients that will see me, and before they see me, I will always ask them to maintain a minimum 3 to 5 day dietary log. And in that dietary log, I can pinpoint what exactly are they reacting to, or what could be some problems that they're dealing with when it comes to food, right? So that is easily identifiable. So food symptom tracking, super important. And the last one is an elimination diet. So elimination diet is done by eliminating all high histamine foods as well as histamine releasing foods. So all the high histamine foods, foods that contain high amounts of histamine, and foods that are liberators of histamine from the body, are completely taken out of your diet. And then we gradually start adding one by one, and we can understand more of the triggers, more of the specific symptoms. So that's how we can figure it out. So if you are interested in figuring out what's going out with your gut health, if you are interested in understanding whether you could be struggling with histamine intolerance, or if you are someone who's doing a lot to help heal your gut, you're trying to do everything on your own and nothing seems to be working, it is time to book a consultation with me. You can click on the link that's provided in this write up to set up a virtual call with me, or you can also contact Blue Water Nutrition at 519-336-5258 to book your 15-minute free consultation. And in that consultation, we can definitely talk about your health concerns and how I can help you. So that's the main talk for today. We are talking about histamine intolerance. And in the next session, we are going to talk about different foods that are going to be, triggering your histamine. So, what should you be avoiding and what should you be eating on a histamine intolerance diet? So, that's the topic for the next session. What to avoid, what to eat, what foods are high in histamine, what foods are liberators of histamine is going to be the main topic for the next session. So, show up next week at 7 o'clock. If you need any support with your health, just feel free to directly message me, or you can click on the link and book your 15-minute free consultation. That's all for today. Have a fantastic evening, and I will see you next week for another Wellness Wednesday. Bye for now.